So Tara here has got complaints of some chronic low back pain, and just wanted to show you an example of what this compression through the spine looks like, as well as these short hip flexors that we're talking about. So if you can see Tara from the side here, her pelvis is tilted a little bit forward. It kind of makes her bum stick out a little bit, and also kind of puts this little arch in her back. And it's not always easy to see for someone who's untrained to see these things, but it's kind of being pulled down and forward this way, such that all of this gets shortened through here. There's definitely not as much length through her low back as there could be, and it's probably kind of ouchy, isn't it? Yeah. So if we can free up through the hip flexors and through the front of the hip joint here, then we can get her pelvis a little bit more neutral, almost as if she's tucking her tail under just a little bit more than she is now, and create some more length in through her low back. So we're going to go ahead and show you how we might do that. So now we're working into the psoas, which is the one that comes all the way up onto the spine, and that's usually the problem for most people. And just to make sure I'm where I want to be, Tara, I'm going to have you just lift your right foot off the table just a little bit. Perfect. And set it back down. So that lets me know that I'm right on it. And just let me know if anything feels kind of gassy, stingy, bleh. But if it does, I'll move off of it. And just like we did, I'm going to have you extend that leg down. Good. When you get to the end, bring your toes to your nose, press through your heel, reach it nice and long. Yeah. Get a nice stretch in through there. Good. And bring it back. Good. Now I can actually come to the inward edge of it and just change my focus a little bit, and I'm going to have you once again straighten out that leg nice and slow. Perfect. Reach that leg long, press through your heel. Good job. Nice. And bring it back. And so now that we've worked one side, I of course will work the other, but just for the sake of experiment, let's have you stand up and walk around a little bit and just see what you notice in that leg. So, in order for me to make sure I'm where I want to be, I'm going to have you just lift your foot off the table just a little bit. Good, set it back down. And one more time, just lift that foot. Perfect, and back down. And this time, go ahead and slowly straighten out that leg. Good. Press through your heel, bring your toes to your nose. Nice. Feel a good stretch?
Yeah.
All right, come on back. And one more time, go ahead and extend it back out. Good. Yeah, great. And bring it back. Alright. So I'm going to let you take that for a little walk around and just see how that feels. See what you notice.